Hi guys, this has to be the stupidest idea yet by the Tories to deal with the cost of living crisis. I say yet because if Liz Truss takes over, I imagine some even worse solutions will be in the pipeline. So according to The Guardian, GPs could prescribe money off energy bills under Treasury plan. So as costs of energy are forecast to hit as much as £6,000 next year, the Tories have been scratching their heads for ways to deal with this. And the word deal is doing a lot of heavy lifting here. This plan, for a better choice of words, first appeared in The Sun, which would ask GPs or family doctors to sign off on who should or who shouldn't get financial support. The idea being that instead of using some sort of means-tested solution, doctors would write a heating prescription for patients if they said that they were struggling. This is another kite-flying exercise, I would imagine. Throw out some harebrained idea and see how the public react. If they like it, make it official policy. If they don't, deny everything. Well, the reaction from GPs was less than positive. Professor Martin Marshall, the chair of the Royal College of GPs, told the media that family doctors were not qualified to assess whether people should or should not receive additional financial support to help them cope with rising cost of living. He continued, "We are also working under intense workload and workforce pressures, making more consultations every month than before the pandemic, with falling numbers of GPs." He finished with, "Action does need to be taken to address this and minimise the impact of rising cost of living on people's health, something that will impact on our most vulnerable patients most. But this cannot fall on GPs and our teams to facilitate." Other GPs criticised the government for coming up with a plan that requires them to basically do the work of the welfare state. Now, I believe the idea behind this would be to offload both responsibility and blame onto the GPs. If a person makes a request via their GP and it gets rejected, the doctor will likely get the blame, not the government. The current Tory administration doesn't want to get involved as Boris Johnson will be gone in a few weeks, and the two candidates don't want to mess up their chances at the last minute by announcing a policy that could sink their chances with the Tory base. I haven't been able to get my hands on any real details of this plan, perhaps because there aren't any. But it does raise some questions, such as, wouldn't this add to the already heavy workload? Would GPs be compensated for this work? What happens if a doctor makes a request and it's rejected by the Treasury? Is there an appeals process? Who is responsible for the request? The Department of Health, the NHS, or the Treasury? What if doctors issue a blank request for all patients? Do people need an appointment? You know, during a time when doctors are being told by the right-wing press and the government that they aren't dealing with the backlog fast enough. And finally, doesn't this breach patient-doctor confidentiality? But I imagine you guys can come up with a whole range of other questions. This is an ill-thought-out plan by a bunch of individuals who either don't care about fixing the problem or are afraid to present real solutions as it would annoy the Tory voting base. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.